Safe Schools, and we will be the moderators for this session. Michigan Parents for Safe Schools is a coalition of county-level pro-COVID mitigation group leaders from across the state. Katie is also here with us today, and she is part of MiPass. We are about 10,000 members strong across all of our groups in Michigan. Tonight's session focuses on the intimidation and harassment that is widespread across the United States and is a large issue within our state of Michigan. Public health officials, elected officials, school board members, superintendents of our school districts, and parents advocating for COVID mitigation commonly face harassment and intimidation from anti-mask, anti-vaccine community members, and even from other elected officials who are openly anti-COVID mitigation. We hope that at the end of this session, we'll have shed some light globally on what we face in the United States when it comes to COVID mitigation, implementation, and advocacy. Our panelists tonight are public health officials who can speak to the level of intimidation and harassment that they themselves and their colleagues have had to face in implementing COVID mitigation policies. Welcome to all of our panelists, and thank you so much for joining us for this discussion tonight. Please introduce yourselves and tell us about some of the challenges you and your colleagues have faced in advancing COVID mitigation strategies. So, who would like to introduce themselves first? Linda, do you want to get started with us?
Uh-oh.
Oh, there it is.
Okay.
Like I got muted by somebody. I can't unmute. So here we are. My name is Linda Vale. I am the health officer in Ingham County, which is Lansing, Michigan, which is our state capital. So it is definitely an interesting place to be a health official right now, given that all of the courts and all the legislature and all of that meet in my county. So including one of those Rudy Giuliani circuses over the election back in December, which turned out to be a exposure event because Mr. Giuliani came down with COVID just a couple of days later. So we, at this point in time, really are facing kind of an escalation of issues, right? As kind of we're winding down. I mean, we're not winding down the pandemic in the sense it's going away. We're going to be in an endemic situation and dealing with this virus for a while. But you would think as we're out of closures and things like that, that people would be winding down. And instead, the vitriol has escalated. Attempts to issue mask mandates in schools result in just vile, vitriolic, hateful kinds of things at meetings, as well as letters and emails and all of those sorts of things that we receive on a regular basis. I have a colleague in West Michigan who was, somebody attempted to run him off the road after he issued a mask order. I have another colleague who basically was subjected to hours of just hateful, awful comments, including basically the fact that she should be put in the gas chamber. I myself have had my share of threats. I received some threatening hard mail, a snail mail at my home, which means these people had found my home address. And just recently, I have an individual that likes to email me frequently with, accusations of child abuse and other things. And yesterday kind of escalated up to where he was sending me emails. Oh, well, there were 3 of them that came in 7 minutes. The last of which said, you're going to be held accountable. And does Nuremberg ring a bell? So, we are faced with just this antagonistic, I can't. It's hard to describe. It's a very challenging situation to be in because all we're doing is doing our jobs that we were appointed to do, jobs that our public health code says that we are supposed to do. You shall do these things to protect your community in the case of an epidemic or an imminent danger, and that's what we're doing. But the past year and a half has just resulted in this escalation. Our legislature is attempting to pass bills to basically amend our public health code so that we would not be able to issue these orders. Our legislature is also behind a petition drive called Unlock Michigan 2 that also would amend the public health code. Norm's going to talk about that stuff, so I'm going to stop. But it is just a, we have for the last 2 years essentially put aside our lives, very little boundaries between work and life, tirelessly working, dealing with situations that are challenging, outbreaks in homeless shelters, jails, schools, all over the place. And at the same time being told that we need to go away. And if you don't go away, we're going to come after you with everything we have to basically intimidate you out of doing your job. I have colleagues that have been threatened to be terminated, including one yesterday that on her Board of Health agenda was her termination. She managed to survive that by a really slim margin vote. And it is just an ongoing challenge to do the simplest things at this point in time, which is we have children in schools. They aren't all vaccinated. They're in what we call a congregate setting. So when you get challenged and told, well, you don't have an order that makes people wear masks at the movie theater or all of these other places, like, one, that's an option. Two, it's not 20, 30, I don't know how many kids in one classroom for 8 hours. That is a higher level of exposure risk that has got to be mitigated. And we are trying as hard as we can at this point in time in the state of Michigan, where we did a lot of virtual school last year, and that was not the best outcome either. So these public health mitigation measures are, one, to keep our kids safe so that they don't impact other people who are very vulnerable. We can all agree that our children are much less at risk for serious disease and death. But you know what? Any preventable death is worth preventing, and we're talking about prevention. We have vaccines out there for diseases for children that cause far fewer deaths in a year than COVID has caused in children. And yet we accept those vaccines and we give those vaccines. So the mask issue and being able to mitigate spread and transmission of this virus in schools is twofold in terms of protecting our community and keeping kids in school so that we don't have to exclude them from school over quarantines. And, I could just go on and on about all of my colleagues across this state that have had boards of commissioners or boards of health that basically have threatened to remove their funding. I did have a colleague who basically, her board of commissioners voted to reject funding coming into her department to pay for COVID response activities. But guess what? They still have to do those activities. They still have to case investigate and contact trace. They just do it with less money, less resources, less people to do that job at this point in time because a board of commissioners said, we're not taking that money. It is just an ongoing attack. We did learn yesterday in the meeting, and this is very important for all of you, that it is definitely a vocal minority. Even up in this area where a board of health came after my colleague, when it came down to it, there were far more supporters than there were detractors. But this vitriol, hate, anger, and you've seen it at a Tennessee school board meeting where an individual that was supportive of masks got attacked on his way out, got threatened, we will find you, those sorts of things. So our people who are supportive of the fact that public health officials need to do this to protect your children, to protect our communities, are not being able to show up at meetings because they're scared. And so that intimidation goes far beyond public health officials being intimidated, but those of you who actually support what we do being intimidated to the point where you don't show up to basically have your voice heard because you might suffer the consequences of that happening, just like we have suffered the consequences of making sure that our voices are heard. And so it is quite a disservice to our communities that boards have allowed meetings, boards of health, boards of commissioners, boards of education have allowed basically meetings to go on in a very uncontrolled manner that basically causes chaos and allows actions and things to be said that are unconscionable and should not be allowed in any public meeting. There is a responsibility for there to be civil discourse and for a board chair to maintain that civil discourse, and it's not happening. They are part of the problem, and they are part of amping up all of this anger and vitriol, which ultimately is going to affect our public health system, which ultimately affects the most vulnerable amongst us.
Thank you for all of that. We really appreciate all of your hard work and all of the sacrifices that you've made over the last 18 months. We know it's very difficult, and I really appreciate you bringing up, the fact that there is some things that can happen to maybe lower the temperature at these board meetings. And I think that we need to hold people accountable for that. And I think next, can we go to Norm?
Yeah, can you hear me? Okay, you can hear me?
I can.
You can't see me, but we will make do. So my name is Norm Hess, and I'm the Executive Director of the Michigan Association for Local Public Health. So this is a voluntary association to which actually all of the health officers, like Linda, in our 45 health departments belong. Okay, and so our role is to represent local public health before the legislature, to be a liaison between the local health departments and state departments and other statewide organizations, and to promote communication across local health departments. So I am not a health officer, I never have been, but I interact with a lot of them frequently. So in Michigan, our public health code describes very specific duties and authorities that are given to local health officers to address public health threats. And many of them are also given to the State Department of Health and Human Services for situations that cross, geography. And so the duties are pretty specific about what, and they lie with the health officer. Now, in contrast, the Public Health Code does not very specifically outline the Board of Health role when it comes to these emergency orders. And so Board of Health members are often county commissioners, and they're used to having sort of a different relationship with the county administrator, supervisory, et cetera. And the health officer role is handled differently. And this has led to some misunderstandings when orders were issued and the board was like, well, we didn't approve that. Well, our public health code does not, it purposely sits with the health officer and not with the board. So as a result of that, health officers have been accused of overstepping their authority, which isn't really true. But a lot of folks have tried to amplify this argument, and they use inflammatory terms like medical tyranny, dictatorship, and things like that. So the orders that have addressed several different issues like indoor capacity limits, quarantine, masking, and I would say that masking is really the flashpoint, and it became very volatile when school started the last week of August. And as Linda said, health department meetings, school board meetings have become very uncomfortable, to say the least, because of these groups of loud and often discourteous and sometimes unruly dissenters attend the meetings and create a very unbalanced conversation. And so at first I was a little puzzled about why we don't hear the voice of support. But for reasons that Linda mentioned, people are scared, but also the folks who agree with these mandates do not feel angry. They don't feel like there's a sense of urgency. They are supportive. And so they didn't.
And the recorder bot is in there.
Okay. So this health district that Linda was referencing, I went to the meeting yesterday. It was 6.5 hours long, but it was a very different meeting than the one they had in September, which really was quite frightening for many people who were there. And so I saw yesterday that the voice of support showed up because people were very concerned about their health department, and they knew that the health officer, that there was a motion to dismiss the health officer, the medical officer, and the legal counsel. So I felt like they learned a few things at that meeting in September, and they took some steps like instituting very clear rules about public comment. And also, the room where the meeting was happening was very small, and they set up viewing areas outside of this room. And then when people were going to give their public comment, they were asked to come into the room. So I think that was helpful in that it sort of took the wind out of the sails of this, a large group of folks who were very animated. But I also want to talk about our state legislature a little bit. As Linda mentioned, they have introduced bills to limit the authority of health officers. They've done weird things like tried to exempt COVID from the definition of communicable diseases, which, that it's a communicable disease. And also to prohibit mask mandates for anyone under 18, to limit the power of emergency orders to 28 days unless they're voted on by the local governing body. And this is the actual topic that Linda was talking about, that is a current ballot initiative. And so if this group gets the required number of signatures by March, the legislature can either put it on the ballot for a public vote, but more likely they will just do it legislatively, and then the governor cannot veto this because it's a ballot initiative. And one other thing that, and some of you may have heard about this, the state omnibus budget bill contained language that said any health department with an emergency order in place on October 1st would not get their state appropriation for local public health services. And the governor said, no, that's not going to happen. And the state health department did distribute those funds. And so if there was any litigation, really the state health department would be the defendant, not locals. But also there was another section that made it illegal to require a mask for youth under 18. And both of those measures are very inappropriate to put in a budget bill. You cannot amend the public health code by putting additional language in the budget bill. But it has still caused problems because of the perception that now there's something in writing that is a law, and folks try to exploit that and say that that health officers are not doing things that are illegal. So we have tried to combat that by arranging legal briefings on the public health code, and yet that was one of the things yesterday that really helped, because some of the commissioners were swayed by that because they realized that if they did this, they took this action, they would be on very shaky legal ground and could be subjected to lawsuits. So yeah, lots of different threats coming from lots of different angles, and it's a very difficult environment right now, but we continue to try to support our health officers in any way that we can.
Thank you, Norm. I really appreciate it. So, there are a lot of different angles and different problems that everyone's needing to deal with simultaneously. So it's both the public pressure and also the legal and legislative environment that makes things really tricky. I think next, let's move on to Eric. And that'll wrap up our folks from Michigan.
Okay, thank you. Can you hear me okay? So yeah, my name is Eric Scorsoni. I'm a professor at Michigan State University and director of the Center for Local Government. Yeah, I think clearly the environment for local elected officials, really even beyond public health, has become extremely difficult. And I think there's some real concerns. I mean, there's concerns now about what's going on, but I think there's long-term implications that are really serious. Are people going to shy away from taking positions or running for office in the future because of fears? Because I don't think this is over. I totally agree with Linda. It is a minority, a vocal minority in most cases. But I think the concern is that they are causing havoc in all kinds of areas now. And I do think they're going to try, because I think the governor's race in Michigan next year will be very much about some of these issues, for example. And if, depending on who would be elected governor, we could face even more challenges where you don't have a governor that's going to veto things, where they're going. I mean, we already know what's happening with other parts of government, whether it's voting rights or other things. This is all part of a strategy of really, essentially deconstructing government. And so this is part of a bigger movement that's going on. I mean, we had a sheriff in Michigan who claimed he could arrest the governor, essentially for what she was doing. I mean, the governor's powers have already been significantly limited by the legislature to respond to this pandemic, which quite frankly has a lot of problems. We have a lot of different responses now because of that, and that's really not ideal. So I do think, I also worry about funding for public health. I hate to say it, I was concerned when I realized how serious this pandemic was going to be last year, that I was concerned, given the political environment in this country, that some of this kind of things was going to happen. And unfortunately, it's even worse than I thought. I do think funding longer term is at risk for some of these areas in public health, whether it's at the local or state level. I do think people need to, I know a lot of us support this, but we have to then be vocal about it. We have to go out, we have to vote, we have to go to meetings. I mean, most of us don't. The last thing we want to do is go to a public meeting, in most cases, but I think it's important. I mean, I'm assisting the mayor of Flint for the last year and a half during this pandemic. I've been in Flint several days a week, and it's a community that is a good example where, you're already having economic problems, and now you're having this pandemic and a water crisis. And I mean, there's a real equity problem too. I mean, the communities, Ingham County is a decently well-off community, but a place like Flint is, really being hammered by this crisis in a way that is just making it very problematic for people's lives. And so I do think I really want to send the message that we who support these initiatives and efforts of our public health officers need to be more vocal. We need to support them. We need to ensure they have the funding. And I know there is risk, and I personally have been threatened, and I'm not even a public health officer, but yeah, there is some of that out there, and people try and track you down through social media and things like that. But I mean, I think if there's enough people out there talking about this and being vocal, that's going to be much harder to do. It's easy to isolate one person, but if there's more and more people supporting people like Linda, then I think it's going to be harder for them to do those kind of activities. So yeah, I am concerned this is only going to escalate, especially with the election next year and then in 2024. I mean, I think we all have to take stock that this is not going to end quickly or easily, that these challenges are out there. And I guess my message would be, we have to be really vigilant now, because, we see what's going on, not just with public health. I mean, election boards, which are one of the most things nobody thinks about. And yet all of a sudden there's all this activity around local election boards and commissions and who's in charge of these things, which quite frankly, they're all ministerial. They didn't have, nobody even thought about them. But now all of a sudden it matters. And so I want to kind of emphasize, this is going beyond public health. It's affecting other parts of government and our ability to function. So I would just really urge people to pay attention, be vigilant, that these, that our, I mean, I don't want to be hyperbolic, but our democracy, we have to be part of it. We have to be active participants. And so I would just urge people to pay attention, to go to meetings if you can, to support these people, to support the funding they need, so that they could do the jobs to help protect us, to help, whatever it is, whatever function they're doing.
Thank you so much. I've been a huge advocate of people going to the public meetings, because it is one thing to watch these clips on the news, and it's a completely different thing to sit there for 5 or 6 hours amongst people. I, I was at the Oakland County Commissioners meeting a couple weeks ago, and they broke. And when you watch it, they adjourned the meeting, and when you watch it on YouTube, it just says meeting adjourned. There's like a green screen up. Well, while the meeting was adjourned, the crowd was, yelling, "Let's go, Brandon." There were people talking about, if I'm going to be labeled a terrorist, I might as well act like one. And I do understand that being in those environments can sometimes be scary. My hope is that now that our little kids can get vaccinated, that I can get more people into the meetings physically, because I know that was one of the things that was keeping people out of public meetings, is that most of the people attending the meetings aren't wearing masks, and they're probably not vaccinated, given what they're speaking about. So not only was there, kind of an intimidation factor, but there's also that additional health risk that's involved. And, I think it would be very helpful if we could get some rules in place and enforced in meetings. That's probably unlikely to happen, but it might help get more attendance at the meetings. Next, we're going to kind of move out of Michigan, and I think we'll go to Dr. Resnick next. Oh, where'd she go? Lori, can you go next then? Did I freeze? Can you guys hear me? Okay. I can't get Lori or Beth. Jennifer, do you want to see if they can hear you?
Can Lori, Beth, can either of you hear me? If you can hear me, try to refresh your browser. Maybe we need to do the same thing with the allow it, maybe the microphone enabled, or try to refresh your browser, see if that works.
Beth said she's on her phone, and she can hear us, but we can't hear her.
Where's our support? Person back.
And I see Lori moving, but I don't know that she can hear us.
Oh no, Beth has no power. Okay. Where's...
I guess at this point, while we kind of wait for them, does anyone in the audience have any questions?
Fault, front door.
Nicole, who are you waiting for? Or what are you waiting for? Okay.
Nicole, I think you're on mute. We're
I am.
having problems getting Beth and Lori to hear us and also for us to hear them.
And Linda said she can't hear anything anymore.
It may help if she refreshes and comes back in, just to redo the browser. We're having some audio issues, but why don't you refresh, just restart the browser, and see if that solves the problem. Can you hear me?
Kind of.
Yeah.
So essentially leave, refresh your browser, and then log back in. Is that what you're saying in here?
Correct.
Okay, so if you guys can hear me, then leave a session, refresh your browser, log back in, and then come back into the share SC room.
Hey folks, what can I help with?
We're having some audio issues, so.
All right. Anyone in particular or just in general?
Quite a few of us now, but our speakers, Beth and Lori.
All right.
So we currently said to log out to refresh the browser and then to come back in.
Lori is the person who needs to be set up.
Beth Resnick and Lori Freeman.
All right. So Beth and Lori, I know you're logging in and logging back out, so you might not actually be here yet. Nope, they are not. So I'm going to give them a sec before I give them any further directions. How's everybody else doing? Is anybody else having issues? Oh, Lori.
Hey, Lori.
Hello. Can you hear me now?
Yes.
Yep.
Yes. And then Beth is in the summit entryway. Oh, there she is.
I see Beth. All right, Beth, how you doing?
Would you like Beth to go first?
You know what? Why don't you go ahead and go first? And it looks like we've still kind of lost Beth.
Okay. And if she appears, I'll make room for her so she has time to speak.
So I see Beth, but I can't hear her.
Yeah.
There you
Can
are.
you guys hear me?
Yes.
Yay.
Yes.
Okay. Go ahead, Lori.
All right. So, well, thanks for having me with you tonight. I'm Lori Freeman. I'm the CEO of the National Association of County and City Health Officials, also known as NACCHO, and we represent the nearly 3,000 health departments across the country at the county and city level. So, you know, and I just hearing from the other local health officials on the call tonight, you know, what I have to say is mirrored across the country. But just let me frame it up a little bit more for you if I could. So, of course, our local health officials have been leading on the front lines of the pandemic response. We like to call it the front lines of the front lines, you know, in front of healthcare, you know, for now, you know, 20 months, providing vaccinations, testing, contact tracing services, monitoring the health of those exposed to COVID, you know, doing the full gamut of pandemic response and really employing relevant public health authorities around mask usage, indoor occupancy, vaccinations, but overall just working to keep their communities and the members of their communities safe, well-informed, and, you know, kind of dispelling mis and disinformation along the way. These health officials live and work in the communities that they serve, so they're very attuned to the needs and of their communities and very committed to protecting them. They've had to make difficult choices, of course, throughout the pandemic around the health and safety of their communities, and constantly deliberating over decisions on masking, vaccinations, school and business openings and closings, ensuring quarantine, isolation of individuals. And really, while the pandemic has brought a greater appreciation by many of the importance of public health, I think the people who are committed and working in the field are experiencing a lot of threats to their jobs, their safety, and in lots of cases, their families even. The threats have come from community members, organized anti-government militias, politicians, and others. One of our members, Dr. Jennifer McKinney, recently testified to Congress about this on Capitol Hill, which we were very glad to have the opportunity, along with Beth. She was there, and her quote was striking to us, and it reads as follows: "Even though the virus is the enemy, their anger and frustration are often directed toward public health officials like me." And really, the threats have taken a huge toll. We've had over 300 public health officials leave their positions since the pandemic began. And if you calculate the impact to that on the populations that they serve across the country, the impact of those losses are 20% of Americans are literally without or have been without a public health official in their community helping to keep them safe. The types of attacks have varied greatly. I have too many terrible stories to share, but they run the gamut from a rural health department in Colorado actually had a militia group take out a radio advertisement campaign against the health official. They then went to her house and they vandalized her car. Attempts were made to poison her pets. And it just goes on and on. A lot of these are gun-toting people that are threatening, showing up at the homes of health officials. We heard, of course, here from about the Michigan health official that was run off the road. So they're terrible. We could go on and give examples. I think what we want, what I'd like to wrap up with, so I can give Beth time to finish up here, is what impacts that these have. And community meetings and hearings have been postponed or canceled for safety reasons, and delaying on sometimes needed public health actions that have to be done. And that those kinds of actions further fuel the anti-public health efforts of these groups. Many of our health department leaders have either stopped attending meetings or events in person due to security threats to protect themselves. And the impact really goes beyond the COVID response too. These health officials, the departures come at a time when we are having a workforce crisis in public health, especially at the local level. Over the last 12 years, we've lost over 20% of our workforce because of disinvestment in public health. So now we're losing a big swath of leadership across the country. And these positions, health departments don't have a deep bench to refill these positions. These positions are coming at a time when they're hardest to backfill, leaving leadership gaps in communities across the country. And we're losing a lot of institutional knowledge that we will not have as we continue to fight the pandemic. And the threats and the violence and these stories, keep new talent from wanting to work in governmental public health, and makes it more difficult to recruit and retain and grow the leaders of tomorrow. I'll wrap up by saying we have strongly requested that Attorney General Merrick Garland include the protection of public health department officials and staff and his directive to federal authorities to meet with local authorities to address the increased risk in harassment, intimidation of school-related personnel. We asked and we demanded that same protection for public health officials. And then finally, I'll just wrap up by saying we did some work with the National Network for Public Health Law and examined across the country states that had protections in place for public health officials. And there are about 35 states in Washington, D.C. that have a statute that includes language broad enough to include public health officials and to enact criminal statutes to punish individuals who impede the public health officials' duties to execute on the ground. But honestly, what we're seeing is zero prosecution. And so that's why we wanted to bring it to the to Attorney General Merrick Garland's attention. But this is a crisis within a crisis, and NACCHO is working very, very hard to both elevate and raise attention to it and find ways to help our public health officials feel more protected in their space. And one very last thing I promise is that, we did a study with the CDC and that looked at threats to lower level employees, which are harder to track. But what that also found was that 26% of those that responded experienced stigma or discrimination because of work, and 24% felt bullied and threatened, and that that this also translated into PTSD type mental health impacts for these staff. So there are a lot of impactful issues that are coming from these threats and intimidations, and they have to stop, and we have to find better ways to protect our field. And I'll close there and turn it over to Beth.
Thank you so much, Lori.
All right. Well, thank you, Lori. Can you guys all hear me?
Yes.
Yes.
Oh, great. Okay. Well, and first of all, I'm Beth Resnick. I'm the Assistant Dean for Public Health Practice at the Johns Hopkins Bloomberg School of Public Health. And I just want to thank all of our panelists, and particularly those of you on the front lines of the front lines, as Lori so aptly said. I never, I've worked in public health for about 30 years. I actually worked at NACCHO. I started out my career there. I've never been a local health official myself, but I've worked with local health officials throughout my career. And when we think about the skills that we need as a public health official, we talk about epidemiology, people skills, communication. I never really thought the word warrior fit in there, but I think it does this year. And I really want to thank all of you for all the work that you've been doing. It takes, as someone put in the chat, a lot of courage and a lot of persistence. And I also want to thank Lori at NACCHO and all that they've been doing. We have partnered with them on some of the work that we have been doing around trying to tabulate and calculate how much is going on. We did a survey with NACCHO, and over half of the health departments that responded indicated that they'd had some form of harassment or, and this was earlier on. This was through the time period we were surveying was through January 2020. And as you all so aptly said, it's escalated, and a lot of the anger. So what I wanted to talk about, and as Lori said, I did testify in front of Congress, and we've been trying to pull a coalition. We're calling it the Stop Coalition. NACCHO is part of it, to stop the threats and harassment of our public health workforce. And I think it was Eric from Michigan State who was saying, I think this is part of a larger issue, but for public health, it's been a long-term issue in terms of neglect and defunding of our public health system, which Lori mentioned. But when I testified and when we're thinking about this in terms of how to move forward, I think of it as sort of three things coming together, and that we really need to think about all of them and think about our future moving forward, as this is not just COVID. I think this is a longer term anti-government type thing that we need to think about and be prepared for and act against. So our coalition, what we're talking about, it's sort of three areas. The one is obviously the threats and harassments. I couldn't describe it I can't say any better, any worse, because of, what some of these panelists have been through. And again, I want to thank them for their courage. But, this has got to stop. And as Lori said, there's definitely a lot of interest in thinking about laws and legal protections in our group that we're working with. Includes the FBI, the CDC, the Justice Department, lots of national organizations. So lots of people want to assist. I think we're all still in that stage of trying to, first of all, realize, wow, this is actually happening across our country here in the United States. Who would have ever figured that? Secondly, what do we do? How do we get a handle on this? So we're working to think about laws, protections. How can you connect with the FBI if your local law enforcement not only not helping you, but adding to the fuel to the fire? Is what other options are there? So working with the Network for Public Health Law, as Lori said, they've already been involved. So there is, I know it might not feel it, but there is a lot of support out there to try to figure out how to handle this and get a grip on it and move forward to have some action to protect our people. The second area, so the threats and harassment is absolutely number one, most important. We're also, we are working on a letter, Lori, I haven't sent it to you yet, but I will be requesting that CDC create a reporting system so we can have numbers and figure it out. As Lori said, it's very hard to find out. In the newspapers, we're hearing more about the leadership, not so much the other staff members and the impact that it's having on them. So the second area is just general public health infrastructure, right? You can't, my husband works for the fire department, you can't get to a fire without a hose, right, and put it out. If we don't have the people and the equipment and the structure and the data to be able to do our jobs, right? Thinking about mask mandates and all of that, so much easier if we'd had better data and more information to understand what we're doing and being able to target. Granted, there's going to be people that are against this, but also if you have better information and understand what's going on, feels like we've been through this pandemic, half of it, at least at the beginning, in a dark room with no lights on, right? Trying to figure this all out. So getting us the people and the supports and the infrastructure that we need. On the national level, there is the American Rescue Plan and the money coming. But again, Lori has been working really hard on this, is making sure that this money gets to the right places and hits the local level in ways that people can actually use it. So flexible funding streams and making sure that the money gets there so that you can hire people that you need to do this work. And then the Public Health Authority, as you guys were talking about in Michigan, again, this is cutting us off at the knees, right? We've had public health authority since even before our Constitution with quarantine and things, and vaccine mandates. So again, if these legislation passes, I don't need to tell this room, we all know, right? This could hurt us in other illnesses and other ways going forward. So really important to be able to think about some model legislation and making the case stronger for why public health authority is so crucial to being able to do our job. It's basically taking away our fire hose for putting out a fire. It's a fundamental public health capacity tool that we have to be able to do our job. So again, elevating these issues and making sure that people understand the implications of this, right? Again, it's an emotional thing right now. Don't have my kid wear a mask in school. Doesn't mean that you want to cut the health department off for all illnesses, all diseases going forward. So I think, again, an education piece, and again, obviously at the local level, this is hard to do, but with the schools of public health and other national organizations helping to promote this information, I think is going to be critical, as I think it was Eric talking about upcoming elections and making sure that people have the information they need to make decisions. So the last thing I want to leave with, because I know we're running out of time, is just, Lori was talking about the crisis of the workforce, and the one